Here is our host, Tian Wei.
Hello and welcome to World Insight and our special program, The Frontline, dedicated to the fight against the pandemic COVID-19. I'm Tian Wei. Europe's hardest hit nation, Italy, has reached about 105,000 COVID-19 cases and recorded over 11,000 deaths, amounting for more than a third of all global fatalities. On Monday, Italy's health minister said the coronavirus lockdown will be extended at least until April the 12th, urging its 16 million citizens to stay at home. But there are some signs, some say at least, that infection cases are slowing down, with the country reporting the lowest infection cases in 14 days, which begs the question, have the COVID-19 cases in Italy at least peaked? If not, when? For answers, we talked to Professor Giuseppe Remuzzi, who is a well-known Italian scientist who's the director of the Mario Negri Institute for Pharmacological Research in Milan. Let's hear his assessment about the latest situation in Italy and in Europe as a whole. Now we are joined by Giuseppe Remuzzi, the director of Mario Negri Institute for Pharmacological Research. Professor, welcome to our program. I want to start by asking you how you are and how things are in your country.
The number of patients admitted to the hospital yesterday and today is less than the day before. So we start to see some possibility to ventilate more patients than we did in the past. We are passing the same problem you had in Wuhan now, and the hope that in the next couple of weeks things will be better.
Yeah. Professor Remuzzi, one of the things people ask is that whether, besides the ICUs and the emergencies, the general public, particularly when some of the mild cases being isolated at home, should be gathered together and quarantined as a group. Professor Remuzzi, what's your take?
The ones who had contact with patients affected by the disease or positive to the test should stay home and isolated for at least 4 weeks.
But some suggest that maybe a group quarantine is better. For example, in the makeshift hospital, rather than staying at home, because they could still spread the virus, even staying at home.
Yeah, certainly. They could spread the virus and contaminate family members unless family members pay particular attention. So if you have the facility to keep all these people who are asymptomatic but had contact with patients who were positive, and if this patient tests positive, certainly if you can create a collective quarantine place for them, this would be ideal. We in Italy do not have this possibility.
Are you planning about that, or this is not in the plan yet because you are dealing with so many emergencies all at the same time, Professor?
I don't think we are planning to do that. I don't think that we will have resources to do that. We are recommending people to stay home and take precautions. What I can tell you is that if the people take strict precautions in terms of mask, washing hands, and living in the same home, but staying relatively separated as far as food and hygienic services, these will protect them enough. I have a story to tell you. those doctors who are called now COVID doctors in some sense, because they are in constant contact with very sick patients in hospital, like in my hospital in Bergamo, or this has been in South Korea. Those doctors, despite the fact that they are in contact every hour with very contagious people, they don't become sick. And the reason is that they are very well protected. They protect themselves in a very special way, having vests, having glasses, having a false mask, gloves, and everything else. The problem is those doctors who are in the territory, family doctors,
Yes.
they are not enough material to protect themselves. So the question is to protect those people with appropriate facility. If you do that, you don't need to create big spaces for quarantine for all the uninfected patients. Also because it would be very difficult to identify them, and we certainly, in Italy, we don't have the possibility to identify all of them.
Professor Remuzzi, since China was in the fire first, so we've seen some of the things with the latest development. Probably Italy could also be careful about. For example, China now is worried about the resurgence, meaning those patients that were treated and with the test apparently being negative, now some of them are going positive again. So from your perspective, what are some of the lessons and experiences China had encountered could be of any reference to you in Italy now?
Well, the first important things that China teach us in Wuhan was to close the contacts, to close the city. And in fact, we have closed Lombardy exactly as in Wuhan has been done. And in some particular area, like Codogno, where this has been done in very strict sense, like in China, the disease has already somehow disappeared because new cases are almost zero.
Yeah.
That's the first lesson we have learned. The second lesson is that you have to have hospitals dedicated to COVID patients. And as far as I know, you have been brave enough to build in something like a couple of weeks or even less, 2 bright new hospitals for COVID patients. This, I think, is the second important lesson. The third lesson is that you need to have enough ventilator in dedicated place to ventilate these people.
Yeah.
The fourth lesson, which is partly in China, but especially in South Korea, where this is done in a very sophisticated way, is how to test. You cannot test the entire population, because if you test the entire population, as the British seems they want to do, it means that you have a lot of resources and human forces and everything dedicated to testing. And once you have established that, let's say, 80% of people test negative, literally the day after, you should, in theory, test them again, because it could be that these people became positive, as just you said now. So the fourth important lesson is what you are saying now. Those who are cured, or those who believe to be cured, cannot left home or left places in which they have been contained in quarantine before they have at least 2 tests negative. And even so, we are not completely safe.
Yeah. Professor Remuzzi, as you may know, we just do not know much about this virus. Well, we do know some, but not that much information as much we want to. So there are a lot of possibilities, so which means experts like you have to have contingency plans while you have a crisis taking place at the same time. So many different kinds of possibilities, and you are dealing with the ongoing crisis. Professor Remuzzi, when you are on the battleground, quote unquote, how are you trying to balance these two, Professor Remuzzi?
I think that there are some important things to do. We have to understand why these people die of this unbelievable pneumonitis. This is not the usual atypical pneumonitis of transplant patients or of immunodepressed patients or of those patients who have leukemias or lymphoma, that they have depression of immune system because of the drugs, and they develop this pneumonitis. This is a very difficult pneumonitis to treat, and we need to understand that. If we understand the reason of that, and I'm sure that via the clinical research we are doing, being clinical researchers, I am a doctor myself and a research person, I think we will find out what's going on in the lung of these people. And I think that once we have understood the reason for that, the therapy will be very easy, or maybe represented by something that we have already. So I am optimistic that we can create a cure before the vaccine is ready. The second opportunity is the vaccine. I know that you have one that apparently has been just tested in human volunteer, and it will be ready by the end of December. The question is, however, that we have no idea whether this vaccine will be effective.
Yeah.
We have some idea, for instance, that if you do a test for looking at the antibodies in these patients, you may say, well, this patient has developed the antibody, so there is no problem any longer for the future. This is not true, because apparently some people who developed antibody of the IgG type, so the ones that shows that the infection was there many days before, is not recent, they may be protective antibody, but they may disappear in matter of 1 or 2 years. So
that's right.
Months. So this is a very difficult situation.
Professor, as you may know, after the European countries, the U.S. is now experiencing the most devastating time. Only maybe later in April things could change. Now, when you look on the sidelines, what the U.S. is doing right and what is doing wrong from your perspective?
I think it would have been important to decide to close the city, as you have done in Wuhan, as soon as they can. I realize that this is a problem with the economy, but the economy should be regarded as a short or long-term effect. If you are looking at the short-term effect, this may be a mistake, because it's better to have a short-term difficulty with economy than a long-term trouble. So allowing people to go around or partially to go around will undoubtedly disseminate the virus.
All right. Professor Giuseppe Remuzzi, Director of the Mario Negri Institute of Pharmacological Research from Italy. Thank you so much, Professor. Be safe and all the best.
Thank you.